Hi, my name is Alvadina. I'll be your nurse today. How are you?
I'm good. How are you?
I'm good, thanks. Can you please verify your first and last name for me as well as your date of birth?
Yeah, John Doe, 12/1998.
Thank you. Do you have any allergies?
I do not.
Perfect. Do you know what we're going to be doing here today?
Kind of.
Okay. Well, we're going to go ahead and insert an IV catheter into you. That's going to be a needle going into your vein with a little tube attached to it that's going to give you your medications or fluid, whatever it is we need today, per our provider's orders. And we're going to go ahead and get our supplies, make sure that we have everything. So we have our J-Loop, our normal saline, our ChloraPrep, as well as the IV that we'll be using, and our bandage. Alright, so we can go ahead and begin. Well, prior to beginning, we should go ahead and get this prepped, so we don't have to worry about it. And we're going to make sure that we remove this, that it is sterile. We're going to be keeping that in there. And we're going out with 30 seconds. Let's go ahead and prime it so we can just assure that there's no occlusions in our tubing or holes. Okay? Now we can begin. Alright, I'm going to be working with this vein today. Alright. We're going to apply our gloves. Here I would ask, so sir, are you allergic to any chlorhexidine that you know of?
I am not, no.
Alright, perfect. And if you were, I would use alcohol as a substitute and rub in circular motions for the 30 seconds and let that dry for 30 seconds. But since he is not, we can go ahead and use our ChloraPrep. So we would pop that open, cover the 2 to 3 inches that we'll be working with. But since the mannequins don't dry very well, we will not. However, yes, we would apply it for 30 seconds and then let that dry for 30 seconds without blowing on it or contaminating it. So we'll reapply our tourniquet. Alright. We're going to get our catheter. So I'm going to go ahead and pull back the blood return. Get our tape ready. We're inspecting it for flaws. There are none, so we can go ahead and insert. Alright, and I see blood return, so I'm going to go ahead and advance forward. Hold that stable. Remove our tourniquet. Throw that in our sharps container. Aspirate for blood. Yes, and we see blood return. Go ahead and inject the 3 milliliters.
And then I'm going to go ahead and place the sticker on my website that says you can see the date, the time, and then my initials. And then I'm going to go ahead and keep your
We'll go ahead and clamp this closed
I will go ahead and
while keeping this stable.
lock this, and then remove this one.
Go ahead and tape that.
And then I would take this to the side.
Gonna get our bandage. We're also noting the site. How does it look? It looks good. There's no signs of infection or anything. No abnormal swelling. We can go ahead and remove this. How are you feeling, John?
I'm feeling really good, thank you. I didn't feel a thing.
That's really great to hear. So that's on there nice and snug. Now we've assured that everything looks great. If we could, we can keep this tape on or remove it per the patient's request. We have to consider skin breakdown. We have tossed all of our supplies. We've cleaned up. Now we can get our IV site sticker and we can label it with the date, the time, what we've done here today, if applicable, our initials, and as well as our needle gauge. We used a 22 gauge. So we would apply that on Mr. John here. And then we would go ahead and document if he had, how he tolerated the procedure. So how did you tolerate the procedure? Were you okay today?
Yeah, I tolerated it well.
Perfect. We would discard our gloves and document the patient's tolerance, the needle gauge we used, the date, the time, as well as how the procedure went overall.
Perfect. Thank you.
You're welcome.